Happy New Year, everybody. It's Wednesday, and I have taken a couple of weeks off. I am not in the office this week, but I thought I'd go ahead and do a quick Wisdom Wednesday just to hopefully eliminate a lot of overwhelming concern and fear over what we're seeing with the Omicron variant and what I have learned over the last 2 or 3 days as far as looking at it from a virulence standpoint, looking at it from an infectious standpoint, and looking at it from management standpoint. So we know that this is exceedingly easily transmissible. Certainly getting a lot more phone calls through the office in the last week or so. And folks seem to be having fairly mild cases. It does appear in most instances to be just exclusively upper respiratory and symptoms of headaches and congestion, some fever, which tends to go away fairly quickly, and most folks are done with this particular variant and with this particular upper respiratory type of viral illness within 4 to 6 days. This is what we've been seeing, and we've been managing this pretty much with just over-the-counter medications. It appears that this particular virus enters our cells through a different mechanism than what Delta certainly had done, and therefore it has a different mode of action once it gets in the cell, it appears, and much milder. And we think that with or without vaccine, although the vaccine does seem to temper the infection, that folks are generally getting through this without too much drama and trauma, fortunately. We continue to look at the supplements and lifestyle. So fortunately, most of our patients have been educated on lifestyle issues. We know that viruses do feed on sugar. This is a time of year where there's a lot of sugar around and alcohol, etc. So if you feel like you're coming down with anything, I would strongly encourage you to rethink nutrition and definitely back off on sugar and starches. I would eat a very highly vegetable, plant-based food program with proteins, whatever source you prefer, but I would definitely stay away from processed foods and from anything that is likely to raise blood sugar and affect a strong insulin response. It's just very inflammatory, and it's much better in the body while it's healing to give less stress, particularly in the gut and all around the body. So things like bone broth, the old chicken soup things, are always good, as well as just a plant-based nutritional program. Doesn't mean you can't have animal proteins. It just means that you want to stay away mostly from processed foods and stick with animal proteins that are fed their natural diet. So as we look also at the Omicron variant, it appears that it races through populations fairly quickly and then is dying down. We're seeing that South Africa, as well as Portugal and other countries, have had big spikes and now have come down. Death rates appear to be significantly lower. There's been a recent study with just some nutraceuticals, vitamin D, which we've all talked about regularly, magnesium, and B12. All of these things, if you all are doing our med packs, you know that you're getting these things. And this particular combination was studied in in Singapore with hospitalized patients, and they did a randomized controlled placebo trial with this and found that those people with modest dosages of these particular supplements, 1,000 international units of vitamin D, it was, I think, 150 milligrams of magnesium, and maybe 500 micrograms of B12. These are all relatively low doses, actually, but daily given, that as opposed to a group that was given placebo, significantly less need for ventilation and oxygen therapy, and significant improvement in recovery. So we are getting more and more data about the nutraceuticals that are out there, and we know that the current monoclonal antibodies have not been particularly effective with this variant. And we're not really seeing people, even some of our high-risk patients, have not had significant issues with this. I think a lot of it is hopefully because either you've been vaccinated or you've been doing the supplements to optimize your immune system. So I think that it's still very important to continue to practice what we know as far as isolation. When you're sick, go home, don't go to work. It's been very frustrating, I know, for many of you trying to get tests, and test kits are not only are they not particularly available, but they also have had some false positive, false negatives. So it's been a little frustrating. I would suggest that if you are just experiencing cold symptoms, we know that 50% of the time at least it's going to be a COVID type infection. And so just go home and quarantine, and it looks as though 5 days is adequate. It's possible that antigen tests can continue to be positive for up to 10 days. Whether or not you are infectious, we don't know. So erring on the side of caution, you might want to consider staying home if you are testing. But it appears that if you've had no fever and symptoms have abated within 5 days, that you are safe to re-enter the world. Hopefully this has given you some information and some help just to calm a lot of concern and fears that we have concerning this virus, and just use good common sense. A lot of the over-the-counter medications, Dayquil, NyQuil, Robitussin, have been very helpful. We have had to call in a few products for cough for a few people, but that hasn't been the main symptom for most folks. So you all have a great day. Again, Happy New Year to everyone. Looking forward to getting back in the office next week, and we will try to set up, I'm working on trying to get a good outline for the year of how we want to continue to share these pearls of wisdom on Wednesday. And again, if any of you all have ideas or questions or concerns, please let us know. Have a great day.